All right, well, hi everybody. My name is Becca Elrod, and I am here to talk with you today about ways to integrate those patients that have an SUD experience into your quality improvement work with some tips and tricks of things that we've learned along the way. So we're going to first get started here on the next slide with some LEI considerations when engaging SUD patients in quality improvement work. So if you've been around Mama's Voices for any amount of time, you have heard that term LEI. But for those of you who may not have been around, maybe this is your first experience with us, what that stands for is lived experience integration. On the next slide here, I'm going to dig into that a little bit more with you about what that means. So in this maternal health space, especially over the last probably 5 to 7 years, patients being a part of work has really changed a lot. So one of the things that we noticed is that patients might have been involved with things like PFACs or been labeled a patient family advisor, but they may not have been an active part of that project. And more often than not, we found that that patient was really just there to check a box for the organization to say that they had a patient as a part of it. And so we decided that we wanted to change that and really have patients be integrated into work through a partnership. Because we know that those who are closest to the pain need to be closest to the conversation. So we started the LEI, the Lived Experience Integration Training, to help teach those how they can integrate them into their work by giving them examples of ways to do that, like advisory groups, having patients review materials that they have, and more. And this is something that we love to provide education and training on. But today we're really going to look at this through the lens of using a patient that has an SUD experience. So on the next slide, we're going to talk about some level setting about what our patient engagement philosophy is. So first of all, we'll start with honorifics. So one of the things that we practice is we acknowledge and we respect those that have higher degrees, but we don't use honorifics in any of our group setting. So something as simple as not putting MD, for example, next to a name on a Zoom screen can really help alleviate and calm a nervous patient who's really scared and apprehensive about being a part of a project that you're doing. And so if you're thinking about integrating a patient into like a quarterly webinar, for example, that you might have, if you just have Becca on there instead of Becca MD, that just automatically creates a space for everybody on the call to feel like we're all at the same playing field. This has actually been something that I have seen witnessed firsthand really be a negative for a patient who was a part of a project a couple of years ago, and she didn't talk at all throughout the project. And so at the end of it, the organizer came back to me and said, "Hey, this patient did not give us any feedback as a part of this work group, and we just wanted to know, did we do anything wrong? Is there anything that we could do differently?" So I met with that patient, and what it ended up happening is she said, "I just had white coat syndrome, is I just was so afraid to talk about anything." And so I highlight this because it really does have a lot of power to just not use any honorifics, to just have first last name basis on there. So we just challenge you to do that when you're having your meetings. Another area for you to think about is evidence-based. So in this space, we know that data drives so much of the work that is moving the needle, but it's really important to know that just because something may not have been published doesn't mean that it's not credible. So patients bring such a valuable perspective to this work, and so I'm so grateful for all of you that are on this call now, and those of you who are maybe watching this after it's been recorded, who really are wanting to learn and understand more about how to integrate patients. When you have patients that are going to be sharing their experiences, it's really important to know that sometimes a patient might say something And you might think, like, your first instinct might be, oh no, that's not true, or there's no way that that could be. And maybe you're right, maybe you're wrong. It doesn't really matter. What does matter is using that as an opportunity to see how communication could be improved in the future. Because regardless, that is how that patient had it communicated to them. So think about that as you're having patients involved in different efforts that you're putting on at your facility. And then also to recognize that we all have triggers. So when you're integrating patients into your work, especially those that have that SUD experience, which is so highly stigmatized, use those opportunities when topics start to get uncomfortable, and they likely will. And when you find yourself feeling triggered, and you likely may, to know that this is a way for you to grow through your experiences. When you are integrating somebody who represents SUD or their family support person, so it may not always be the patient itself, it might be their support person. It's really important to always be transparent about what their exposure is going to look like. So oftentimes patients want their work to be highlighted, but those who represent this demographic, they have shared with us that sometimes they don't want to be credited for that. There's varying reasons on that, from being worried about future potential job challenges if their name is shared, to just the embarrassment that some of them still feel because this is such a stigmatized role. So it's really just important to just kind of level set and have a basic understanding of that. On the next slide, we're going to talk about where you can recruit patients to participate in some of these efforts. So you'll see here on the screen, you'll see thinking about existing partners where you already maybe have an established relationship. Thinking about family or patient navigators that you might be affiliated with. Also, treatment and recovery centers, reaching out to NA and AA meetings and seeing if maybe they have some patients that you could find. Also, community-based organizations and WIC offices, and then also utilizing family members. We talked about that it may not just be the patient itself, it might be a family member using like a church flyer, newsletter, bulletins, things like that, to put that out there. On the next slide, we're going to talk about where you can, or I'm sorry, we're going to talk about some important things for you to consider as you are recruiting these patients, recognizing that often trust can be a barrier. So it's always nice to send them a personal invitation with permission to make a connection. Also to share with them all the information in advance. So if you're going to be recruiting this patient, think about they want to know all of the logistics. So oftentimes a patient is excited to get involved in something, but they want to know all the semantics of things. So what is it that you're expecting them to do? What is the time commitment for it? Who is the audience? What is the agenda like? Do I have to dress up? Like all those little logistical things that might seem really small are really, really important to share with patients. It's also important for them to know what are their qualifications for participation. And then last but not least, to fully anticipate and be responsive to any barriers that they may have to participate. So think about childcare, transportation, etc. I've worked on projects before where meetings have been adjusted so that they could meet the needs of a child's nap schedule. So I had a mom who said, hey, listen, I want to be a part of this, but my child is with me. I don't have childcare. Can we adjust the meeting? And so they adjusted the meeting to be from 1 to 3 when their child was taking a nap. So anything that you can do to just be more accommodating of their schedule really can go a long way for that patient to feel like they're included and like their voice really does matter. On the next slide, we're going to talk about compensation, which is really so important. So as I mentioned, because there is an increased risk of exposure due to stigma or an impact on future employment, it's really important to understand the importance of compensating them. So I think we could all agree that if we have, if we're encouraged to participate in something and money is offered, that is often a motivator to encourage consistent engagement. If you think about if I'm not going to be compensated for something and you're asking me to show up, 6 times a year, I may not show up if I'm not compensated. And thinking back towards childcare, transportation, other barriers that I might have. But if I know that you're compensating me for my time, I'm going to feel like my voice is valuable and I'm going to ensure that I show up. And also to just be reminded that their jobs are not funded to allow them to participate in. So a lot of you that work in the quality improvement space, that part of your role and part of your salary may include you sitting on different committees and things. But for those patients, that's not included. And so it's really important to just think about that, to also think about the importance of what you're asking this patient to do. So not only is this a very highly stigmatized topic, but you're asking this patient to really share about some really traumatic events. You're asking them to open up some really sore spots and some wounds that they have that maybe they've buried. And so it's always nice to compensate them for their time. Um, Here at Mama's Voices, we do a lot of teaching and training on compensation. So I'm not going to go into that now. But if you're interested in learning more about that, please reach out to us because we would love to detail that more and help you think creatively as you're looking at your budget restrictions and things like that that you might be challenged with. We really love to help teams think collaboratively and creatively how they can compensate patients.